their view of how things have been going in the region ever since the hurricane. Some people felt that the region has already recovered. Others, however, felt that there were still things that needed to be done. But regardless, everybody agreed that they need jobs, they need infrastructure, they need help with their livelihood. And so there are still things that need to be done. And that's why our panel was put together. My name is Melissa Lee Massatelli. I am an attorney, and I'm a part of the Filipino American Lawyers Association of New York and one of the founding members. This is Chris Lepenig. He is also on our steering committee, and he is our tech guru for tonight. Chris, why don't you step in front of the camera and wave, even though the people at home have been seeing Chris all evening, smiling and waving.
Yeah, I don't want to be identified as a tech guru because of all the problems that we've had so far. Again, we are lawyers, the main organizers, not IT people. And so we want to thank everyone for joining us, and thank you for bearing with us with our extreme Filipino time. We will go ahead and send the PowerPoint presentations after the fact so that folks can look at both of them. And so for now, we'd like to get started with our very distinguished panel of speakers that we have sitting at the table.
And actually, before we do that, we should thank our sponsors, our co-sponsoring organizations. Step back in front of this thing so maybe you all can see me. We would first and foremost like to thank Hinshaw and Culbertson. Those are our hosts for tonight. And we were brought here by Connie Montoya, who is off to the side as well.
Hi, everyone.
And also a steering committee member, I'm having problems talking tonight, for the Filipino American Lawyers Association of New York. We'd also like to thank our other co-sponsors, the Broadway Barkada, the Filipino American Coalition for Environmental Solidarity, Homegrown Philippines, Cultivating Success, Kaya, DC Chapter, Collaboration New York, National Filipino American Lawyers Association, Next Day Better, Philippine American Bar Association, and Filipino American Unity for Progress, otherwise known as UNIPRO, who were responsible for the very professional-looking flyers that you all have probably seen. So I'd like to turn it over to Chris, who will introduce our panelists.
So, unfortunately, this is how we're going to have to do it in here. We have Dr. Gabiola, who is on the line.
Oh. Please don't sue me if I hit you.
Okay, sorry. So again, we have Dr. Gabiola in Stanford, along with Michael Nettleman, who's our documentarian. I know in our program we had a couple of things before the discussion, but just for the sake of moving the discussion as quickly as possible, we're going to do all of those things after our panel is done. But at any rate, we have Rachel Kelly Davis from Homegrown Philippines, who's going to be our moderator for this evening. We have the Honorable Ambassador Mario de Leon, the Philippine Consul General to New York. We have Shirley Domingo and Eleanor Chichioko Bahoy from Gawad, Kalinga, New York. I think that's it, right?
I think that's it. And if anybody has any questions for our esteemed panelists, please feel free to tweet us. We are Fala New York, F-A-L-A New York, on Twitter, or you can email us at Falany, F-A-L-A-N-Y, 2013 at gmail.com.
All right, we'll turn it over to Rachel right now.
Okay, so good evening, everyone, and to those tuning in via Google, good day to you all, wherever on earth you might be. So I'm Rachel Kelly Davis. I am a co-founder and the culture curator for Homegrown.ph, which is an online entrepreneurship and startup magazine based in the Philippines. I'll be your moderator for today's panel discussion, and I would like to thank Falany for putting this together for us, specifically Chris Lepenig and Melissa Lee, who have been coordinating the entire event for over a month now. So we all know why we're here, because almost a year ago on November 8th, 2013, the worst storm in record history of the Earth made landfall in the Philippines. The world's response was incredible. Governments, private companies, and people everywhere on Earth donated and volunteered money, goods, their time, and in many cases to themselves to aid the survivors of the storm. In the 11 months since Yolanda had made landfall, we have heard horror stories of devastation, loss of life, inefficiency, and corruption. But we have also heard horror stories of triumph, camaraderie, of ideas and innovations that have worked, and of the world-famous resilience of the Filipino people. So the main questions we have here today are, 1, was it enough? 2, what is the state of the Visayas now? And 3, what more can be done? As Chris mentioned, today we have 3 panelists, Dr. Julieta Gabiola of the Stanford School of Medicine, Ms. Shirley Domingo, who is the New York coordinator of Gawad, Kalinga, USA, and the Honorable Ambassador Mario De Leon, the Philippine Consul General to New York. So at this moment, I'd like to give each of the panelists just 1 to 2 minutes to introduce themselves and to give us a brief background of their personal involvement in the Typhoon Yolanda relief efforts. We can start with the Ambassador. Would you like to begin?
Yeah, hi, I'm Mario De Leon. I'm the Consul General of the Philippines based in New York. And at the same time, my personal involvement, I would say, with the first the relief and then the rehabilitation is more to projects we did with the community in the states under my jurisdiction, which are 10 states in the U.S. Northeast. So that's the 6 New England states: New York, New Jersey, Delaware, and Pennsylvania.
Yeah, my name is Shirley Domingo. I'm personally a businesswoman, self-employed, but actually the area coordinator for Gawad Kalinga. I represent thousands of volunteers of GK, but we are based in the USA. Currently, the Philippines, we power the movement of Gawad Kalinga. I've been a volunteer and an advocate of GK since 2009. GK USA has been at the forefront of emergency response efforts every time calamity strikes in the Philippines. And we as volunteers and are based in US respond to any call for support thrown to our end by the Gawad Kalinga headquarters in the Philippines. In 2012, GK USA launched the Disaster Relief Fund, which encouraged Filipino Americans to contribute to the emergency fund that would become immediately available, so they don't have to wait for help whenever calamity strikes in the Philippines. When Typhoon Haiyan struck in November, GK USA was able to immediately send support on the first crucial days of the aftermath and was able to distribute food packs to affected families. We will be providing more, information on these efforts shortly.
Dr. Gabiola?
Hi, thank you for the opportunity. I'm Julieta Gabiola. I'm a clinical associate professor of medicine at Stanford University, and it's nice for Michael Nettleman, who's my medical student, and I to be able to join you. My involvement with Tacloban is I had the opportunity to actually do a medical mission there in January of 2013, 10 months before the typhoon. And at that time, it was a beautiful area, and it's still beautiful now, but it was a beautiful area with great resources, and we had the most wonderful time. I had 55 volunteers with us, doctors, nurses, pharmacists, medical students, and other paramedical people help us, and we saw about 6,000 patients at that time. So when the typhoon struck, when we had the typhoon, I was part of the team from Stanford Medical Emergency Rescue Team who were deployed to go to the Philippines. So we were there 10 days after the typhoon, and it was really sad where everything was really gone. But so we were questioning what we were there for. We served a lot of people, went to the remote areas of Tacloban, actually outside Tacloban, because when we reached Tacloban, there were the presence of multinational forces there, lots of them. And so we decided to actually camp out farther from Tacloban, so we could actually serve the remote areas where they were not reached yet by the multinational teams. We had the most wonderful time. We felt really good in terms of what we had done for the people, but it's never enough. It will never be enough, because after the acute and subacute phase, we're now faced with the same phase of chronic disease in the Philippines, further accentuated by the lack of resources, and lack of affordability, the geography, and multiple other barriers. So I think there's a lot more to be done. And we're going there again for a medical mission in February 2015 after the papal visit. And hopefully we'll serve again, followed by a more sustained program, which is a medical mobile clinic that we would like to get started in Tacloban, and then we'll further disseminate in many parts of the Philippines for sustainability and continuity of care. And I'm the co-founder of ABCs for Global Health, and that's why I'm involved in this Global Health project. We have research in the Philippines.
I think they're back.
Okay, well, that's
Okay.
great. Because,
Yeah, I think they got it.
And we also have a research project ongoing. Project
We are continuing.
of diabetes.
Okay.
Very much.
Thank you, Dr. Gabiola. All right. Well, let's continue with the housing discussion.
All right. So I asked, can you tell us what each of your initiatives have done with regard to housing, community, and livelihood? And what challenges and problems can you identify when it comes to these three aspects of life in the affected areas? Okay, Ms. Domingo, let's start with you.
With the new bill.
Okay, I'll have to read these notes. As we all know, the aftermath of the typhoon brought about figures that are beyond the records and the history of, I guess, the world. The destruction was just so massive, with deaths recorded at more than 6,000, as you have mentioned, and a total damage of close to $3 billion. As we mentioned earlier, GK USA had launched in 2012 the Disaster Relief Fund, as we wanted to be able to send immediate relief and support to the Philippines during the emergencies. It was not just GK USA that is supporting the work of Gawad Kalinga in the Philippines. We have very active volunteer teams in many parts of the world. Even before the typhoon made landfall, GK had mobilized hundreds of volunteers in Ormoc and Cebu for food packing and prepared for food distributions. The same team planned on logistics, given the challenges of moving food to where it was needed. Many of the volunteers traveled on foot to be able to bring food. Even the traveling on foot was a task by itself to the affected families. On the first week of GK's emergency response, the volunteers had distributed more than 100,000 food packs and aimed to reach more families who needed immediate help and support. That same week, GK USA was able to wire a total of $100,000 to the Philippines to help power GK emergency operations. Less than 2 weeks later, another $200,000 was sent by the GK USA to the GK Philippines. In the next 3 to 6 months that followed, GK continued to have a presence on the ground and worked with the national government and local government units in the rehabilitation phase. GK was involved in both rehabilitation and reconstruction efforts through the rebuilding of homes and communities. The next slide shows a report that as of July 2014, where more than 1,500 houses were being constructed in at least 12 provinces affected by Typhoon Haiyan. The 1,500 houses were built by more than 1.7 million volunteers, who all traveled to the Visayas during the Bayani Challenge from April 9 to June 12. Filipinos from all walks of life joined hands and helped rebuild affected communities. A contingent from GK USA and Canada also participated in the event. The goal of GK is to have 6,000 houses reconstructed, 1,500 fishing boats provided, and 1,500 roofs repaired by December 2014.
Microphone. We don't know what that was.
Okay.
Okay.
You want to continue, Eleanor?
What's that?
That was not a part of the presentation.
As you can see, GK is not just rebuilding homes. The aim was also to support the means of livelihood of the affected communities. In the Visayas Islands, fishing is the main source of income, and the typhoon just devastated the people's means of livelihood. When the GK Barangay project was launched, several partnerships with community groups and the local government units were formed. More than 600 fishing boats have been turned over to families, and GK's goal is to provide 1,500 fishing boats by the end of the year. In total, GK USA had provided more than $1 million, which covered disaster and emergency relief, medical missions, housing, community centers, and livelihood projects. The aim is to build 6,000 homes, and GK will continue to work on the ground. In fact, the goal by the end of the year 3 is to build 20,000 homes in the Visayas region. And we need more support, and we hope to build more partnerships in the United States and be able to encourage more people to help GK in the rebuilding efforts. In closing, we thank the organizers of tonight's gathering for this opportunity. Our hope is for the work of GK to be spread out to not just the Filipino-American community, but to everyone. This will provide an opportunity for the people of America to extend support to where it is needed. At the end of all this, the task is so great and sometimes very frustrating because there's so much work to do and so many people to help, and it's our efforts, even though sometimes we feel that it's small, but we can't be overpowered by that, frustration that, what we're doing is so little. Because the important thing is we just keep doing. Eventually more people will help, and somehow we made a difference in the world, or we made a difference in the Philippines.
Okay, thank you. Ambassador, do you have anything you'd like to add?
No, I have a presentation.
Okay.
First of all, I just want to say that I am the highest government representative in the area. So what I intend to do is, of course, the government response since Yolanda or Typhoon Haiyan made landfall in November 8, 2013. So if we just go to the presentation, essentially what I intend to do is echo what the Office of the Presidential Advisor on Rehabilitation and Recovery has reported so far. So I think this would be a good context to speak about where we are now as far as the government is concerned. So can we move on? Well, anyway, this is just the track of Yolanda, and as you know, it devastated about 171 cities, affected more than 12 million people, damaged more than 1 million houses, and at the same time, we had about 6,268 who died. I mean, that's the official figure, about 1,000 still missing, more than 28,000 injured. So those are the official statistics. So on December 6, 2013, I don't know if any of you know this, the President signed Memorandum Order number 62, appointing former Senator Lacson as the Presidential Assistant for Rehabilitation and Recovery, or PAR, right? So right after the appointment of Senator Ping Lacson, the President also came out with what he called the RAY, which is, of course, the government's framework for the planning and implementation of recovery and reconstruction. This was presented in December 2013 before the international community in Manila. In fact, it occurred at the DFA. And when Senator Lacson took over the job of course, coordinating and managing the rehabilitation and recovery efforts, the first thing that he did was, of course, to call for what he calls a post-disaster needs assessment. So the RAY was more of a development approach. It was a top-down approach when it comes to approaching, of course, the recovery and rehabilitation, while what Senator Lacson did when he came in is what he called the post-disaster needs assessment, which is a bottoms-up So what they asked all of the affected municipalities and cities were to submit their own rehabilitation and recovery plans. But it took some time. We have to remember that most of the local governments were devastated as well, and many of their staff also died as well. So based on information we got from OPAR, they were only able to get the complete rehabilitation plans of all of the cities affected as of July this year. So it took about several months, and we're talking about planning. I mean, it's of course a bottoms-up approach, so meaning they really inform the national government this time of what they really need. Okay, so now what Senator Lacson did was he formed what they call a cluster framework, wherein there will be plans for infrastructure, resettlement, social services, livelihood, and of course support, which is of course the funding. I mean, can we go on? No. Now, where are we now? Okay, move on. Now, I just want to talk about international aid, because a lot of questions have been raised about international aid. You know, as of July, total pledges received by the Philippine government was about 71 billion pesos, or that's roughly about $1.6 billion. About 44 billion were in cash and 27 billion were non-cash. But what was received so far is about 15 billion pesos, or that's roughly about $342 million. So in other words, from the pledge to the actual receipts, there seems to be a big gap. Okay, so this is just to put into perspective, you know, all of the announcements that came out right after Haiyan hit the Philippines, and at the same time, a lot of course, the press releases came out. But that's the score, according to, of course, the presidential advisor. Now, based on what I said, the PDNA and the RAY, they came out with this plan based on the 4 areas that I mentioned: infrastructure, social services, resettlement, livelihood. Based on the next 3 years up to 2016, it will require about 170 billion pesos of funding. Okay, in US dollars, that's almost 4 billion. Okay, that's the estimate of the presidential advisor. What was funded so far is 37 billion. Please remember, this is a 3-year plan, so they funded about 37 billion. So if we look at the accomplishments, more or less we will pit it against what was funded. So what is still needed is about $3 billion spread over the next 2 years. So that's quite a big amount of money, or in pesos, it's about 133 billion. Yeah, can we move on? Now, as far as the infrastructure cluster is concerned, these are examples of accomplishment. In terms of national roads, about 116 kilometers were damaged. Just 7.5 were completed, and 108.8 kilometers are ongoing. When it comes to the airport, 6 were damaged really badly. 2 are already completed, and 4 are ongoing. When it comes to the municipal halls and the public markets and civic centers, I think all of these are already being addressed at the local level. And when it comes to health facilities, 13 health facilities were rehabilitated, completed, and 27 health facilities are still ongoing. Okay, social services. About 4,267 families were transferred to 267 transitional houses. So far, those are the figures. Almost 35,000 households were given cash for doing community work. This was the Cash for Work initiative that started right after Haiyan hit these provinces, and at least they were able to give cash for doing community work. Now, 400,000 packs of learning kits were also distributed, about 180,000 copies of learning materials. Okay, this is related to of course, education and the same surviving. And when it comes to medicine kits, about 1,540 essential medicine kits were distributed, about 302 weighing scales, 313 height boards. Again, these are just examples of the accomplishments. When it comes to livelihood, more than 2 million beneficiaries receive, of course, from humanitarian partners, delivery of livelihood programs and training. So this is all over. I'm talking about all of the provinces that were affected. Now, the cash for asset, emergency employment, more than 100,000 beneficiaries benefited. Fishing boats, 15,760 got fishing boats and replacement of damaged engines. And when it comes to the farmers, they got farm implements, about 9,149. Now, resettlement, I think Shirley here mentioned about the efforts, of course, of Gawad Kalinga. This does not include, of course, the efforts of the private sector. So we're talking about 2,965 permanent houses that are undergoing construction in at least those cities: Roa City, Dumangas, Tacloban, Panawan, and Palo in Leyte. And about 153 hectares of government-owned land have been identified as relocation sites. Please remember, when you try to resettle people, you need land.
Mm-hmm.
And, what is immediately available are, of course, government-owned land, not unless there will be private lands that will be donated to government. Now, another aspect, I think, of the comprehensive plan of the Presidential Advisor's Office is the coordination with the private sector. I think this is very important to understand because they're also coordinating with the private sector on what they have been doing so far. And so I think they have what we call three partners: they have what you call development sponsors, sector sponsors. I think Gawad Kalinga is more on the sector because of the settlement. Development is more or less geographic. It's a combination of social services, infrastructure. These are private corporations or private groups. And of course, they also launch what they call a Haiyan multi-donor fund. I'm talking about, of course, the private sector here helping the government. And just to give you an example, these are the development partners per province. For example, in Tacloban, there is the ICTSI, that's a port development and operations company. It's a Filipino company. PLDT Smart, as you know, the giant telecom company, is on the other half of Tacloban. In Palo, we have Metrobank. I mean, those are the examples as far as Leyte is concerned. Now, when it comes to Eastern Samar, where Haiyan made landfall in B1, we have Nickel Asia. I think it's a mining company. Then in Hiporlos, we have the Consuelo Foundation. I think it is based in Honolulu. Then in Balangiga, I mean, if you're familiar with Balangiga, that's the town where the Balangiga massacre took place during the early days of American colonization. And we have Peregrine, which is an American company involved in that. Then in Salcedo, you have Christian Aid. Everyone's familiar, of course, with ABS-CBN. They're involved in the 2nd District of Samar. I think they're involved more on providing fishing boats. The Ayalas are involved in Negros Occidental, Ayala Foundation. The same with Iloilo. And JG Summit, which is, of course, Robinson. The group of Robinson is also in Iloilo. So this is how the private sector in the Philippines is also assisting the efforts. Now, one thing I could say is there is no amount mentioned here, but they're doing their own work, and I think the Office of the Presidential Advisor is coordinating with them so that there won't be any duplication of efforts. Okay? So, now since I am the Consul General in the U.S. Northeast, what have we done? The Filipino community or the community in general. So, our efforts on rehabilitation. One of the biggest things we did here, I mean, this was led by the Consulate General together with members of the communities, what we call the Build a Shelter Project. We launched it about 2 days before Thanksgiving last year. And our target was to provide permanent shelter in 4 towns that were badly devastated by Typhoon Haiyan. We identified 3 in Eastern Samar and 1 in Leyte. And so, since that time, we have already generated $350,000 in cash, And at the same time, 60% of it came from the Filipino community and 40% came from non-Filipino communities. The Koreans, the Vietnamese, they help, because at one time, the Filipinos helped them. So I think they're just paying back. So if we can go on, one of our specific project was in Hernani, Eastern Samar, with the Build a Shelter. And this is already the status of the project. We are able to provide funding for 36 houses. there. We're working with Gawad Kalinga, and funds are being coursed through the Philippine Jesuit Foundation. Okay, so no funds go through the Philippine Consulate. That's what I'm saying. It all goes direct to the 501c3 organization, Philippine Jesuit Foundation, and goes to Gawad Kalinga. So in Hernani, Eastern Samar. Now, aside from that, we identified 2 other towns in Eastern Samar, Hiporlos and also Kinapundan. Earlier, Shirley mentioned Tanawan. Actually, we also have a project with them in Tanawan. We're providing about 22 houses there together with the National Housing Authority. Now, aside from shelter, we also coordinated with a group. They call themselves Class Act. They're composed of architects from Columbia University. And they're involved in actually multi-purpose classrooms. And this is a prototype. They're working with another 501c3 organization here in the U.S. Northeast. It's Handang Tumulong Foundation. So what they intend to do is, together with us, they'll be putting multi-purpose classrooms in the villages that we've already set up. So they'll do one in Hernani. They'll do one also in Tanawan. Okay, so when we move on, and of course we engage a lot the second generation, and so one of the things that we have done is to coordinate with them. Next Day Better, of course, Ryan Letada is involved in that. It's the use of technology for relief and rehabilitation assistance. We linked him actually with the office of Senator Lacson earlier this year, so I think he was able to explain to them what we call, I think, resilient technologies for disaster preparedness. So I think that's what we have done so far as I mean, I spoke, of course, about the efforts of the Philippine government in general up to about July of 2014, and at the same time our efforts here in the U.S. Northeast. So thank you.
Okay, thank you for your presentation, Ambassador. Is Dr. Gabiola online? Okay, so for medicine and healthcare, I guess my question is, well, this is for all the panelists, not just Dr. Gabiola, but in your initiatives, what is being done in terms of healthcare, specifically primary healthcare and the psychological well-being of the survivors?
Let me start by outlining the first phase of the health efforts. So initially, the hierarchy of needs right after the disaster basically was food, shelter, water at that time. So it's either you survive the event or you don't survive the event. People who survived the events suffered multiple traumas. So it's musculoskeletal injuries and psychological trauma. So for the people who sustained the trauma, so a lot of them got to the facilities where they could be helped. We had the Chinese hospital offshore that was accepting patients, and then on land there were all these multinational forces from all over the world who actually help in many different facilities that are operational. There were few hospitals who were operational. Lots of them would not have any autoclave or sterilization equipment, so they were forced to perform procedures that are not sterile, and so lots of post-operative infection from those. There were no antibiotics, no medications available. The people who survived the disaster also lost all their medications, so in terms of taking their medicines for hypertension, diabetes, asthma, COPD, etc., they just don't have any availability of those. So initially, it's really food, water, and shelter. And there were a lot of exacerbation of malnutrition. There were waterborne infection. We had dengue, chikungunya, leptospirosis, and many other waterborne diseases and vector-mediated diseases. And then going to and acute diarrheal illness and parasites and skin infection. And then on the subacute phase, like about a month or a few months after, there were again, because of overcrowding, it really impaired people's resistance to infections. So there are a lot more respiratory infection, pneumonia, wound infection. We're seeing more wound infection, So really, and accessibility to healthcare is still a big problem. And I think it's still a big problem now, although better. So now we're into these 10, 11 months or almost close to a year after, and then now we see the resurgence and resurrection of uncontrolled chronic diseases. And what do I mean with that? So it's the same phase that but what we see in medical care in the Philippines, that the top 3 causes of mortality, meaning death, and the top 3 causes of morbidity, meaning complications, are basically from cardiovascular diseases. And those are all lifestyle diseases. We could prevent them. We could help them by education, prevention, and lifestyle modification. And it's now that we're faced with that now. So what do we do to help that? I think improve accessibility, which has always been a problem. So accessibility, I mean, is not just the presence of healthcare facilities, because there are healthcare facilities, but people don't access them. So there are barriers. So what are those barriers? So geography is one, transportation is one. They can't go to the facility because it's expensive. And 3 is education. They don't know what's available there. They think that they would have to pay, and they don't have money to pay. And some of them would say, well, even if we get there, we go online, we fall in line for the entire day, and then by the time that we get there, they would say, oh, we ran out of medications, and so they'll be back, and after they spend 50 pesos for transportation. So our group is finding ways to bridge that gap. How could we help these people? Despite the presence of local government units, the rural health facilities, people are not accessing that. So we thought about maybe bringing the resources to the people. And I know there are several groups in the Philippines who had basically medical mobile clinic, but those are usually sponsored by politicians, and usually after the political agenda is well served, those disappear, and then there's really no continuity of that. So we felt that maybe a partnership with 501c3, the local government, and other nonprofit organization within the community will help serve the project of establishing sustainable programs, medical mobile clinic, who would really go to the barangays on a more consistent basis. So we could hit all the people with hypertension, we could hit all the people with diabetes, asthma, TB, and COPD, and malnutrition. And then we could even approach maternal and children's health care. So I think we have to stop and think, what are our goals? What can we do to help, achieve those goals and improve the metrics that we have in the Philippines? And I feel, I feel inspired by a lot of people who are actually promoting every effort to put this together, but I think there's got to be a lot more collaboration in the field of healthcare. Yeah. I think one organization couldn't do it, the government couldn't do it. I think it's really a consortium of efforts from many different segments of the society to address this. I think that's the only way we could improve outcome, because if you look at the data in the Philippines, we're probably one of the top country in the world with a lot more cardiovascular diseases, and kidney failure and heart attacks actually occurs among Filipinos about a decade earlier than the counterpart. And we should ask ourselves, why is that? Is it access to care? Is it culture? Is it genetics? I think it's multifactorial.
Okay, thank you, Dr. Gabiola. Would you happen to know, out of the hundreds of barangays that were hit by the province, how many of the barangay health stations are operational?
You mean now?
Yes.
I'm not familiar now with the current data. We were there in July, and honestly, I did not visit a lot of the health centers, when we were there in November, 10 days after the typhoon hit, we really, not many of the health units were operational at all. We put together makeshift clinics, which we actually put together within 30 minutes before we opened the clinic. So we will go to a barangay, we'll put together a bunch of tables and chairs, and we'll put some, like plastic cover, so when the rain comes, we don't get hit. And then we'll see thousands of patients, so within that same day. So that's basically what it was for the entire time. We had our campsite right around Burauen, outside Burauen and Tanawan, and that's where we kept all the medications. We got supplies from WHO, from UNESCO, from Medical Team International. We had a lot of medications, so it's not the medications, but really it's it's just that we couldn't do much during that time. But I think, what's solid is we brought hope for the people, because I think when the people saw all these people from all over the world, they got more stronger in terms of, people are out here to help us. So and they were all nice people, and they were resilient, and they were, the kids were still playing as if nothing happened. So I think to support that structure, we could do a lot better to consolidate resources. And I'm not really sure where the money is going, because I think there should be a little bit more transparency in terms of who are being helped, where is it? Because when Michael and I went there in July to do a documentary, which you'll see part of the trailer, it's actually, we don't know where the money is, because you go to from barangays to barangays, people really didn't have much. They didn't have food. There are no immunizations. People in the same, a lot of families having measles and outbreaks of every infectious disease there is. And I'm not really sure what is being distributed to the people in terms of food, medications, and additional source of livelihood. We didn't see it.
Okay, thank you. Ambassador, would you happen to know how many of the barangay health stations are operational?
Honestly, I don't have the figures, except what I mentioned earlier about 27 health facilities. But one thing I noticed when I was there last February, and I can just speak, of course, from observation, is the focus was primarily to make all of the municipal buildings operational. And I believe if the rural health units are not operating, then most likely it has to be more centralized in the municipal building. That's one. And at the same time, those provincial hospitals that were still standing there, they're of course where most of the patients were going, but that entails a lot of travel and a lot of expenses on the part of the patient. So a lot has to be done there. I had a chance to speak with this Willig Foundation when they were there. They were dealing also, this is a private group that is based in the Philippines, and they were also dealing with UNDP. What they did was primarily educating the city the town administrators, the mayors, about the need to really go towards basic healthcare services immediately in the aftermath. So they're doing a lot on the educational part of it, but of course the infrastructure has to come really from the government.
Okay. So very quickly, Michael, would you like to say something about your documentary?
Sure. Thank you. So my name is Michael Nettleman. I'm a third-year medical student here at Stanford, and leading up to med school, I also worked and studied film for 10 years. And I think the video kind of speaks for itself, but one aspect we haven't really discussed very much that really does play into not only the awareness but the efforts that are going into recovery is the media coverage. And of course, right after Yolanda, right after Haiyan, there was a lot of coverage. You know, Anderson Cooper was there with CNN. And of course, they were covering a very different type of sort of acute post-natural disaster phase that also Dr. Gabiola had mentioned. And so, so we were there this summer. I'm actually going back in a few weeks to wrap up, really looking at some of the more long-term, less discussed, sort of long-term chronic phase challenges that people are still facing that really haven't appeared so much in the media. So namely, we're looking at livelihood, of course, which we've been discussing here, specifically things like fishermen and coconut trees is a major industry in Leyte. Secondly, we also talked with health profession students, so medical school, nursing school, physical therapy, in looking at how they're experiencing this, one having been affected by the typhoon and also being in positions to now do something. And then thirdly, we spoke extensively with the deaf community there and looked at issues of culture, access to care, access to relief. And so I'll let the video speak for itself from here on out, but if you have any questions, I'm happy to answer.
Okay, thanks. We'll actually be tweeting the link to the trailer with the Felony Twitter account, and we're going to be showing the trailer at the end of this event to everyone who's here. I've been told it looks amazing, so congratulations.
Thank you.
That. All right, we're going to be moving on to questions. So if you guys have written your questions down, or to everyone who's been tweeting.
We're going to do two quick things while people are formulating questions.
All right. So I have actually some follow-up questions to what's been mentioned by all of our panelists. My first one is with regard to the no-build zones and the relocation program. How is the relocation program being implemented, and how is it being explained to the people why they cannot move back to their original location?
You were saying about the no-build.
Yeah, okay. I'll try to answer it.
Okay.
You know, the no-build zone was actually first thought about primarily to ensure that those areas where people live, which is beside the sea, they won't go back there because they will always be in danger whenever there will be a storm surge or whether there will be a high tide that will hit their homes. But the problem is you have to have alternative to resettle them. In fact, that was what I mentioned earlier. The government can only react to it if they have available government land where they can be resettled. So the challenge there is primarily where will those land be located. Aside from government land, if you have private land, it has to be in an area which is not in a no-build zone. That's number one. Number two, the other issue relates to the livelihood of most of the people who are supposed to be resettled. Many of them are fishermen, and so they want to be near the sea, right?
Yes.
So that's again a very tough issue to handle. So in fact, even when I was there were very large signs, no build zone, and yet, you see people, they were trying to build some shanties there, and at the same time they had their bangkas, simply because they rely on the sea a lot. So I mean, I think I don't know what has happened from that time, but I believe this is quite a challenge, even when it comes to resettlement by GK, because we also discussed that with GK. Our project in Hernani, it so happened that the GK village there is quite far from the coast, so it was a very good area. The same with Hiporlos, the one we identified in Hiporlos was quite far, so it's a good area. But I believe that many of the temporary shelter that were first built were quite near the sea. So they were, in fact, in no-build zones.
Yeah.
Okay, thank you.
And you can't blame them.
Yes, no, you definitely can't blame them. As I understand, the no-build zones are by the sea and by the rivers.
Yeah.
Right. Okay. My other follow-up questions are, what is being done by the initiatives in terms of disaster preparedness and awareness? Because we're not free from disasters.
Seems to be part of our lives.
How are we educating the people to be ready for the next storm?
Well, there are a lot of initiatives that are being done by PAR. In fact, the Next Day Better initiative, I think, is one good one. I just hope, is Ryan there?
He's in San Francisco.
Yeah, I mean, because if he can present what he presented to the Office of the Presidential Advisor, we would appreciate what resilient technologies are all about. So I think that's important. it's more or less alerting people. And we have dealt with a number of universities here. I mean, that was on the initiative of the consulate. We dealt with Roman University. They have flood alerts, simulation flood alerts, which we need, I think, in many of the towns and cities in the Philippines. In fact, it's really good for Metro Manila, I would say.
Okay, and this is a question I came up with because of something you mentioned about the public servants themselves being affected. So what is the role of a public servant during the time of disaster, especially if they're the ones affected?
Well, exactly. That was the problem, I think, when Haiyan hit Tacloban, right? There was no immediate response because even the police were all affected. And the ones who were supposed to restore peace and order were actually affected. So I think what they're thinking of right now, at least from what I heard there, was there should be something like a contingency plan wherein if a city is devastated, the next city should be in a position to send, their people to take over that city. So I think this is already being discussed. I think what they want to do is to institutionalize all the contingency plans of the local government units.
Right. So I believe that only Mayor Duterte was the one who sent his local 911 team a couple of days after, right? I don't know of any other cities that sent.
No, there were quite a lot. There were quite a lot. Even Metro Manila. What Chairman Tolentino did was each of the towns and cities in Metro Manila adapted the town.
Right.
Okay, that's what they did. So they sent teams there to primarily help the devastated towns.
Okay. Do we have ready questions?
Yeah, so we're going to take just a quick break from the discussion to sort of hear from two updates. The first is from Rochelle Ocampo, from Unipro. She's going to be talking about fundraising in New York, and Melissa Lee from Follow Me is also going to supplement her remarks. And then after that, we're going to have, just to dovetail on what the ambassador said, we have Matt Grasser here from Landline. I'm pronouncing that right? Okay, and they participated in one of Next Day Better's hackathons. And so he's going to do a presentation, a tech demo of some technologies that might help prepare the Philippines and other countries respond to disasters in the future. So I'm going to ask Rochelle to come over and give us a quick update.
Do you have the image by any chance?
Yes.
Or do you want me to scan?
Right next to Rachel.
Yeah. Okay.
No, it's okay. You might want to look in that direction.
Step.
Oh, on the other side of Rachel, maybe.
Okay, hi everyone. I am from Unipro. I'm actually now a board member. We have our president here, Iris Lagoon, who is here accompanying me. So Iris and Noel, who is now the vice president of Unipro, actually created this community calendar for all of New York metropolitan area, and actually got replicated in other cities across the country. So within the New York metropolitan area, there was 128 events or initiatives that occurred between November and February 2014. Within those 128, only 23 actually replied back about how many people actually attended and how many funds they actually collected. So there was a big disparity of how many people actually was held accountable. So that's the key thing that we want to make sure that we come across, is that theme of holding organizations accountable, of how many donations they actually collected and how many people actually attended, and where did they send the funds. So from the organizers that actually replied back, 25 of the events actually sent proceeds to the Philippine Red Cross, 13 were given to NAVCON, and 10 were given to Gawad Kalinga. Now, there's actually 22 events that actually split the proceeds between other organizations. So, say for example, Next Day Better did a hackathon and they raised $2,000. $1,000 would be for NAVCON, $1,000 would be for Gawad Kalinga. So that's an example. So 22 events actually split their proceeds. The one thing that we actually saw that was actually crazy is that within just 1 week, there were 39 events in New York metropolitan area. in 7 days, 39 events that were just for Typhoon Haiyan. And that was in November 17th and November 23rd. So it just goes to show, if we were to create this calendar a little earlier, or have that platform set there earlier, we could probably prevent that overlapping of like 5 happy hours in one night, and having all these resources being split instead of having just one event that everyone can combine and collaborate with. So one other thing that we found was that there was 15 concerts or shows, and over 10 of them were at bars. So it's the type of themes that you would probably see whenever you think of fundraising. You know, you want to entertain, you want to provide drinks. But this is just a little snapshot of the data that we've collected. And again, out of the 128, there's only 23 that actually replied back. So this might actually just be because our follow-up was not immediate, you know. Or maybe one thing that we could do next time is when somebody decides to put their event on our calendar, we have to tell them to contact us with what they report. So again, this is the Unipro Community Calendar. You could go to the calendar now at unipronow.org and just go into, what tab is it? Resources. Under Resources, and then you'll see the tab of the calendar. So that's actually ongoing. It's not just for typhoon relief anymore. It's for all community events. So if I actually have this right here, of the spreadsheet of all the organizations that 128 that actually did their events. If you have an event that is not here, it's because it wasn't on the community calendar. It's not a big deal. It's fine. But if you do see your event here and there's no numbers next to it, please put your email, and then I will contact and follow up with you. And then we also have this spreadsheet that I could make. It is public if you want to ask for it. Is the list of organizations that people actually donated to. So it ranges, it's alphabetical order from ABS-CBN to U.S.-Philippine Society. It lists their 501c3, it lists their tax ID number, how much of your donation is actually going to their administration costs. That's a big thing that you should think about. What's their mission and focus, what areas they actually focus on with their specific donations. So this is a really great spreadsheet if you guys want to look at it. And if you want more information, just go to email us at info@unipronow.org. But thank you for having me.
Great. And thank you for joining us. I think actually you might have my notes.
Okay.
Chris was not supposed to give you my notes. So, Felony was one of the organizations that hosted an event to benefit typhoon survivors, and I'm actually not sure whether we were on this spreadsheet, but we got several organizations together to host this event. It happened on November 25th of last year, and the reason it took us so long was because we had some trouble figuring out what exactly we wanted to do to help. We're a bunch of lawyers, we had just gotten started and really just got informed, so there were about 9 of us in the room wondering what we could do.
You're on the spreadsheet.
We are on the spreadsheet. Do we have a number there?
Yes.
Oh, good.
Do you want your number?
No, I have the number. Although if I'm wrong. So we thought about it, and we created a joint task force together with several other groups, ABNY, which is the Asian American Bar Association of New York, Apala NJ, which is Janice Domingo is here with us tonight, and she was the president at the time. Are you still?
A president now.
Oh, she's the president now. And also APABA, Pennsylvania, and the Asian American Law Fund of New York. So all of these organizations got together, and we decided to host a happy hour. And that happy hour involved a silent auction with a lot of donated things. And at first we thought it was just going to be people's homemade goods, like somebody, like I was learning how to knit, and it was going to be like a sweater, which, I mean, it's been 2 years and I haven't finished the sweater yet. But we ended up with a lot of really great items. We had tickets for sporting events that were donated by law firms. We had a lot of support from local restaurants, and somebody donated boxing gloves that had been autographed by Manny Pacquiao. Mm-hmm. That was a really great item, and I wish I'd won that, but I didn't. We also charged for admission, and it was a small fee. I believe it was around $20, and we also had some guest bartending provided by some law students. I was told I was too old to help with that. So in total, our organizations raised approximately $5,000 that were split between two charities. One was GK, and the other was UPMASA, the University of the Philippines Medical Alumni Society in America. So those funds were divided between those two groups, and we've been looking for actually something else to do to assist as well, and that's why we came up with this conference idea. And so, as you've already seen, where a lot of the funds have gone, the funds that went to GK, and as far as the UPMASA funds, we know that they were provided to that organization to help with medical missions to the Philippines. Okay, and that's all I've got.
So thank you, Rochelle and Melissa, for updating us on the status of donations.
So now we're just going to have Matt from Landline come and just do a quick tech demonstration, a quick presentation about technology and disaster relief, and then we'll move into questions and answers.
So in the interest of time, I think we got started just a bit late. I want to save some time, and instead of maybe demoing this, I'm just going to pass this little nifty tool around. You guys can take a look at it. I'll get to explaining it in a moment. So, yeah. So I'm from Landline, and as I guess I'm here representing kind of the tech community and design community that responded to Haiyan, Yolanda, immediately afterwards. Since Ryan Latata couldn't be here tonight, I was speaking about generally about the types of initiatives that came out of this type of event that they put on just a week afterwards, as well as more specifically what we did as a team. So we started off with the question, what is optimized relief? So we need to optimize relief. We went out and gathered information, and at the time, in the middle of everything, we found that the most important issue that was coming up with a lot of organizations that we talked to and interviewed was that communications immediately after the storm was a huge hindrance to properly and efficiently distributing goods. There was no shortage of efforts necessarily immediately right afterwards. There was not even necessarily a shortage of resources to be given out necessarily, but a lot of the times it just was not being optimized because the information was not flowing between the places that needed things and the places that were receiving them. So in order to understand how to optimize relief, we looked back at a few examples. So in the United States here we had Hurricane Katrina, which was a huge hurricane, 800,000 people displaced down in Louisiana and across the Gulf Coast. And in the response there for communications in particular was these massive trucks that were very expensive and could not get close enough to the area to really be completely effective. And then we took a look at Superstorm Sandy, where Red Cross in New York City and FEMA came in and were collecting information with a pen and paper and sometimes even asking the affected population to fax their needs in. And this led to a few inefficiencies, which was kind of somewhat fulfilled by the decentralized relief, the Occupy Sandy movement that popped up here. This was the community helping themselves in the area, supplementing the larger organizations that were there helping out because of some of the inefficiencies. So here you can see there were a lot of these ad hoc donation centers and ad hoc distribution centers. This is actually a distribution center. It's not perfectly organized, but it was something to help the community. It was the community helping themselves while they waited on responses. So you can see, due to these inefficiencies, even 2 months afterwards, even today, there's still people that were affected that are waiting for their aid to come through. And obviously, the topic of this evening, Typhoon Haiyan, Typhoon Yolanda, happened nearly a year ago. The international community came and helped a lot. The local community and local governments were obviously doing everything that they could to make sure that this was working. And the tech community and design community, and this was something fairly new, actually jumped on this. Tools like Bang on PH, and a few other Philippine designed and developed tools were used. However, the vast majority of these required internet. The tools were amazing. This is an example of one tool where people could tweet or email in or text in information, and it would aggregate the needs and who has things and connect them. But in regions where there was no power or no internet or no cell phone signal, this tool could not reach there. So our optimized relief is this tool that you're passing around here. It's inexpensive compared to these large $1 million trucks. It's very compact and portable. This costs less than a cell phone. You know, if something gets washed away, it's not a big deal compared to a giant truck. It simplifies communications and logistics and provides connectivity where it was previously not practical. So these are huge. It sounds like such a simple thing, but it's a hugely important thing when people are trying to rapidly respond and are unable to communicate through the traditional means. So what we're trying to do is using everyday technology to empower individuals and communities to help themselves. This is extremely important, particularly in the 1 day to 2 weeks following a disaster, before everything comes back up and around. To move on to the next slide, we asked ourselves, what if mobile apps could be used? This is something that people are just as familiar with as a pen and paper, just as familiar with as using an app. What if we could use that information to gather data? And what if a secure network could provide the means to move this data without the need for these centralized structures like the power grid and the cell networks and the internet? So what we came up with is this is a base station here. It runs off of any type of power source that might be available. This one you're passing around is just running off of a rechargeable battery that can be powered by wind or solar or generators in the area. We're participating in a hackathon this weekend that's sponsored by the Feast and the Department of Homeland Security here and several other organizations, IBM, Intel. And what we're trying to do is interface this with a number of other technologies that can use that communications and another number of other technologies that are providing power. For instance, a clip that can clip onto a car battery. So the end goal here is to empower organizations that already exist and individuals ultimately to fulfill requests quickly, to enable field agents to get to where they're going, knowing what they're going to run into before they get there, and ultimately to help cities build resilience by providing this clean set of data that's extremely easy to gather, extremely sanitized because there's validation on the mobile interfaces, and ultimately allow people to use this data to make decisions about the next time. So it's simple to use. It's very easy to deploy. All I did right before this was plug this thing in, and it powers up within 3 to 5 minutes. And immediately afterwards, I'm not sure. I think I'm going to run out of time to show this, but if anybody's interested, I can provide a demo at another time. Basically, it acts as a web server. So I can access this via Wi-Fi, again, without the internet, without cell phones. I can just connect to this little dongle right here with my laptop and run reports off of the data that's being synced to this by our mobile apps. The mobile apps can be configured to collect any information from pins on a map with this bridge is out or there's medical assistance needed immediately here, or things like, there's water needed here, we need a doctor. And these things are automatically brought back with the people who are already moving back and forth. So the cell phones carry the data from base station to base station, as well as the base stations connecting to each other beyond Wi-Fi using shortwave radio and UHF antennas. So this provides basically the functionality of the tools that were existing without the need for these centralized infrastructures. So at this point, we've done some test deployments in the United States. We've been speaking with actually somebody that's part of the ambassadors team, Kara, who's with the consulate here in New York. We've been working with some groups like Next Day Better, Japan Foundation, who's got the Hands Project that's doing some education initiatives, trying to get some deployments set up in the Philippines as soon as possible to make sure that we are solving the actual needs that people have. We can talk for days and interview people for days, but until we get on the ground and really try this out and put this into people's hands that need that efficiency and that efficient feedback loop, we're going to be continually iterating on what we have. So yeah, we'll be around this weekend down at Pioneer Works in Red Hook, working with the Red Hook Initiative and some folks from Next Day Better, some folks from the Feast International. And there's a ton of other cool projects down there along the same lines. I think it's very important that the government agencies, the private sector that are funding this, and the technologists and designers and big thinkers work very tightly to solve these problems, because none of us can do this without the other one. And once we get that together, I think that's when things can really start moving forward very rapidly. Innovations and feedback can happen at a pace that we've never seen before. So thank you guys for your time and for the invitation.
How does it work? I mean,
so I pull out a cell phone
yeah.
that's enabled with a mobile app, and I open it up, and this is completely offline, and it's got a map of the area that's loaded onto the phone offline. And I simply drop a pin on the map. I hold my thumb down. I say, this place doesn't have water, it's out of electricity, and there are 4 children here that need shelter. And as soon as I get within range of one of these base stations, that information syncs automatically in the background. So the way that this currently works, you can kind of see it from the picture in the Sandy relief efforts, is somebody will either record this on a piece of paper or sometimes in an Excel spreadsheet offline. They get back to the home base at the end of the day, the ad hoc headquarters, and they ask some intern or somebody who's been out all day that's very tired to enter all of this data into a more centralized database. And this can lead to things from just time and efficiency, first of all. But somebody who's tired is going to make mistakes entering things. An extra 0 can mean a huge difference in how the response happens. And so what happens is then those databases get transmitted on or transferred on little USB sticks that people run around, or pieces of paper that people run around and have to re-enter. So what this does is, at the end of the day, I walk back and it syncs to the base station, or during the course of my work, I'm moving between headquarters, and the data is syncing to my phone and syncing to here anytime I come in contact with one of these. And these can, like I said, daisy chain. They can connect together to reach the ranges that are necessary to cover an entire region if needed. So, yeah, and again, I think because we're on a bit of a time constraint here, I don't have the capability to display this right now, but maybe after this, if you're interested, I could show you some of the interfaces that and demonstrate how this actually works.
Okay, thank you.
Yeah, thank you guys.
Thank you.
Do we have questions from Twitter?
We do.
Yay!
Actually, we have one question and one comment.
Okay, so I'll start with a comment from Anak Bayan. The Commission on Audit released a report that 1.5 billion pesos of donations have not been spent 10 months after the typhoon. Yes, you can also see this report on Rappler.com. It was published September 8th of this year. And the question from Anak Bayan is, of the billions of donations coursed through the government, how much has been released or spent for Typhoon Haiyan survivors? You answered your own question. Okay. Maybe we'll just answer this question. So of the billions of donations coursed through the government, how much has been released? I believe that was...
Wasn't it shown in the slides?
I know, it was shown in the slides. Do you have questions from people here?
Matt, I have a question.
Sure.
That is beyond Wi-Fi, right? The gadget that you have. How much does it cost?
This machine here, so this is actually about the price of 2 iPhones ago. So about between $350 and $400. At scale, obviously, we can do probably better pricing than that. If there's 100 that are needed for a region or something like that, we can definitely offer bulk discounts. I think that depending on exactly what tools are needed from it, there may be some customization costs. We're working on making the software more flexible so that we don't need to customize it. We can put it in the hands of the people that are using it, and they can enter an administrative interface and say, oh shoot, we wanted to collect the ages of people, and we forgot to ask you guys to put that in there. So you can just go in and say, I want to add an age field to the cell phone, so that when I'm going out with my phone and collecting information, I can add the age, and it'll automatically add it into it.
Any more questions from here?
I guess just as a follow-up for Anak Bayan's question about the donations, I think the question was more for what is being done to push for the donations to actually be used, maybe? Like, is there something that we can do to push the president or the government to really push for these donations to actually be used faster?
Yeah, if that's the question, I mean, I don't have the answer right now of how much have been really expanded. The only information I was able to get from OPAR was on the social services side, that about, I think as of the end of 2013, and this is based more on our report, about 800 million, I think, was expended, and out of those that was given. If you look at the figures I gave, the pledge was very high, but what was received was even less than 1/3. And so many were meant for different purposes, right? So I'm just talking about the social services part. And what they said was about 8, as of the end of 2013. You have to look at how much they expended up to at least September of this year. I don't have the figures.
We have another question, which is, given the current pace of recovery, how long do you think it will take for the region to fully recover?
It's a very difficult question.
Yeah, that's very difficult.
It's
I would say if you look at the comprehensive master plan of OPAR, they're only thinking of up to 2016, or maybe because it coincides with the term of the president. I mean, that's the time horizon they're talking about, and they're talking about 170 billion that is required. Granted, they can use all of those up to 2016, but I don't think it comes out with complete recovery. Please remember, when the typhoon hit Tacloban, it was not merely infrastructure that was destroyed. Many talents, many human resources left, and so the people who are supposed to make their economic recovery faster have left. So I think the challenge there is how you can attract back talents there. Right. I think it's not as simple as what we think it is.
Any more questions?
Why do you think that there's been such a disparity between the amount that's been pledged and actually been seen? Like, that's a huge difference. It was like 750 billion to, I don't even know how much.
Less than a third.
Less than a third billion. Yeah.
Well, honestly, I don't know. Pledges are usually announced. You know, I usually attend pledging conferences in the UN. I mean, countries make pledges, but the delivery is something else. Maybe let's give them a year.
Okay.
May I make a comment? This is Dr. Gabiola. Could it be that the people who pledge, or institutions or countries who pledge, they hear about mishandling of funds? So I think it will be nice to reflect on that and see, could it be better if we have more transparency? So that's one. And then see where the funding is actually going. Is it really going to the people or administration? And then I have a comment on the no-build zone. When we were there, Michael and I, they talked about a survey that was done that showed that in order for people to be safe, they would have to be on higher grounds, not just few kilometers from the seashore. So they felt that the best place to be safe will be on the northern part of Tacloban, and we saw building there from GMA, and it's actually pretty nice in terms of they were building 400 homes. So I think there are a lot of places there that are government owned that actually the government had already put together in terms of putting homes. And then in terms of the disaster preparedness, you know, I think there was to reflect on the experience. I think people were aware of the typhoon, but they were not aware of the gravity of the typhoon because of use of terminologies as there will be a big typhoon, and because people were aware, and people are used to typhoons in the Philippines, it's almost like a weekly occurrence, so they underestimated the gravity of the typhoon. Could it be better to use terminology that's understandable by the layman, like a tsunami type of a typhoon? And they said that a lot of people would have listened to that rather than just ignore the messages from the government peoples, because I think the people were aware of the typhoon about 2 or 3 days before, and also they miscalculated the time that it will hit. They said it will be 12 noon and it hit early in the morning. So people also were caught unaware. So I think improvement of communication should be part of preparedness for a disaster, for disaster training. The right terminology to basically be understandable by laymen and other people. Those are the only few comments. And I haven't commented about the psychosocial issues. There will be a lot of PTSD, like post-traumatic stress disorder, that we will be soon see, and anxiety disorders from kids. Because now a lot of kids, every time there's wind, they get really anxious, and their focus and concentration in school were not up to par compared to the pre typhoon era. So I think we will be putting together units like PTSD, and we would look at what is the best thing for these kids to cope, and even parents. So adults and kids together to see what will be the best counseling program or the best technique that we could use to help them cope with the PTSD or anxiety disorder. I'll pass it on to Michael.
Good. Unless you guys have any other questions.
Do you have anything to add? Oh, okay. So we have last two things. This is for each of the panelists. What are the current priorities of Gawad Kalinga, Philippine government, and your initiative? And who do you think should be doing what? And that will give us, I guess, your thoughts on how our attendees and the people tuned in via Google, how can we all help?
Personally, I think it's such a huge task. I mean, even though with GK, a lot, if not all of us, are volunteers. We're more than 1 million, volunteers, especially the young ones. And Haiyan being a year ago, I mean, people tend to forget. But we don't realize, especially when we live in this society where we're pretty much comfortable in spite of all our situations. And what do I want to, the question, I get lost with this thing that we're doing.
Your priorities?
Our priorities is still the same. We try to, make the people live in homes. But now it's not even homes anymore. It's like at least have a roof over their head, have food. I mean, it's basic, bare necessities. I mean, that has always been our, our goal, our day-to-day, that's what we're trying to do.
If I could just add on GK USA's behalf. So for the donors or the partners who've given through GK USA, we challenge them to give, to sustain the communities that they have given. Let's say if it wasn't for the disaster relief, there's other programs you can give to for community building. If you give a few homes in a certain village, the village doesn't stop at just infrastructure. There's schooling, medical missions for that village. So it's the goal is sustainable development and jobs. That's it.
It's a lot of work.
Yeah, I'd just like to echo what Shirley said. This is a rather very complex undertaking. If you try to coordinate the efforts, the government is just one part of it. I mean, trying to make use, of course, of the various donations that came from other foreign governments, and of course the criteria they use when it comes to spending it. I think some of these donations, I think, have certain conditions, the way you have to spend it, and you have to comply with that, because it's definitely a donation. I mean, that's the way I understand it. And secondly, I've talked with some people on the ground. What is really needed still, almost a year after Haiyan hit the Philippines, is, Central Visayas, is we need a lot of shelter, whether it's transitional or permanent, and we need a lot of classrooms, I think. I think those are the two important things that many people are still need in all of the devastated towns. And if you look at the way the government has even expanded, I'm just being very objective about that. It's those areas which need a lot of focus on. A lot of relief has been given by the international community. There's no doubt about that. I think a lot of assistance in terms of in-kind contribution has been done. But the ones that are more long-term, such as shelter, classrooms, these are things that really have to be addressed. When it comes to fishing boat, one thing I heard is there's so many fishing boats already, because it's so easy to give that. I think what they need are more resilient crops that will be used, especially in areas where all of the coconuts are down. It takes at least 7 years for the coconut to be replanted and to be productive, right? So they need cash crops. They need to know how to farm again. I think a lot of training has to be included in that. So I think what you need are communities that will be able to rise and be able to fend for themselves as well. So it's not merely relief. We have already had almost a year of relief to many of these communities. So as I've said, this is a very complex, complicated undertaking, and I think we need the support of everyone.
I also wanted to say something about the issue on how come there's so much money that have been donated, how come not everything is used. I think, the way I see it, not that I'm providing excuses for why it is not, one of the things I try to understand is, it's easy when you have money. You can't just spend it. You have to plan it, because it's so easy to spend the money. Just in GK alone, even if somebody donates, let's say $50,000, and you know that to build a village takes, let's say, $85,000, unless you have the $85,000, there's no sense in starting it. You have to have all the materials, you have to have all the help, who would do, the skilled workers to do it. You can't just start with 50,000, because before you know it, it's gone. The thing is, you have to have everything there ready so that you do what you're supposed to do 1, 2, 3, 4 in a very organized and very efficient manner. I'm not trying to offer excuses, but I think that's one of the reasons. So what if you have money? Unless you have a plan and how you implement it and be organized about it, it's so easy to use up all the funds. It's better to have the money there so that when the time comes, you really have a plan and a program, then use it.
Yes, of course.
So are you saying that the system or the plan part isn't?
No, it's not that it's not there, but it has, because sometimes when people donate, we want to build a village, but they only have X amount of money. It's not enough to complete the project. The planning is there, but you don't have all the elements to make it efficient, to make it happen, and be successful.
So what's the first 2, 3 steps that you
That's
would
it.
encourage?
You need to have your plan, the project, the plan, and how you're going to implement. Make sure all the elements to make it succeed are there in place, and then you do it. Not just have if you need 85 and you have 50,000, why start spending the 50,000? You have to have it. I'm talking about our organization. Right. I don't know about the billions of dollars, because we don't have that.
So what's the key thing that you need right now to kick off that plan?
Well, to get started, people to have a roof over their heads and make sure there's food for everybody, there's livelihood, and again, the classrooms for the children. Because while they're growing, they can't wait. They'll be growing unless you have all this education. The same thing with what she said, that you have to have the medical missions. Everything has to be done all at the same time.
So on the GK perspective, I think for us, we need to have the team there, because some people donate with restrictions, like we want it only for this province or that one. So I think as a donor, it'd be good to, you already trust the organization, you say, okay, use it wherever you see fit and where it's most needed, because we have those pocket instances where people restrict it, we have to follow what they want, And so yeah, there should be a volunteer team in place. There should be a local government unit in place. There should be different sectors in place collaborating already before the money can be. So that's a very big challenge there.
So after a year, it's not.
It's possible that it could be sitting for a year, because out of the 10 elements, 9 are in place. So.
Okay, Dr. Gabiola.
I think it takes a lot of planning. I agree, and a lot of collaboration because we don't want to duplicate, tasks. So I think a lot of, from thought leaders in agriculture, farming, like our honorable consul mentioned, in terms of because it takes about 8 to 10 years for coconuts to actually grow. So they have to have alternate planning for farming. So agriculture, and I think University of the Philippines has a big presence there, and they're very good. They have a lot of expertise. And I think this will be a segue for Michael to involve media in terms of a consistent awareness about how this project could evolve over a period of years, because you can't rebuild within months or even a year. I think it will take a long time.
Okay, thank you.
All right, so this concludes our program for this evening. A couple things. So the way that Google Hangouts on air, this is our first time using it, so I think this is how it works. The video of this program will actually be available on YouTube after the fact. So this conversation can continue, where this conversation can at least continue to provoke ideas and thoughts about the next disaster that happens in the Philippines or elsewhere in the world. And so I encourage you to share this video with other people who are interested in Haiyan 1 year later, or moving forward, as well as the Philippines and just disaster relief generally. I would recommend that they skip the first 30 minutes of this video to avoid the video of just Dr. Gabiola and Michael laughing at me.
we can edit that part out. So at some point, now I'm on the screen. Hello. So at some point, we are going to edit the video. Right now, it is available in raw form, which is going to be painful for us. But the next time we do this, it'll be much better.
But thank you to Rachel, to the Consul General, to Shirley, to Eleanor, and to Dr. Gabiola and Michael for joining us for this wonderful conversation. For those who are here in New York, I'm going to screen the trailer, Michael's wonderful trailer. I apologize, Michael, I just don't want to risk the technological issues with streaming that online. But for anyone that wants to see it, I'll play it here. And then we'll, as Rachel mentioned earlier, we're going to tweet the link to the trailer so that everyone can see the wonderful work that Michael has done documenting the state of medical relief in Tacloban right now. And for those of you who are interested, I'm sorry?
I was just going to say, I do encourage people to watch it as soon as possible. So since it's really a first look. I mean, we're still hearing back from a lot of our collaborators overseas. So we're going to keep it live only for a few hours following the panel. So I would encourage people to watch it as soon as you tweet the link out, because we'll be revising and sort of, this is really an exclusive.
Okay. If you could, I'll send you an email later, but if you could keep it open a little bit longer, that'd be great.
Sure.
But the last thing I just wanted to say is if anyone wants to join us for dinner afterwards, I think a bunch of us are going to be going to a restaurant that our expert Connie, who knows this area the best, will point us to. So please stick around after the trailer. You can also, of course, ask Matt to demonstrate his landline technology. And yeah, thank you again so much for joining us, and thank you to all of you at home in California or elsewhere in the country, maybe even the Philippines, I'm not sure. But thank you and good night.
Thanks.
Thank you.
Thank you.